So multiple endocrine neoplasia, that is men, and that is neoplasia affecting more than or equal to 2 endocrine glands. There are total 4 types of men, that is men 1 to men 4, and these occur mostly as a inherited forms, most commonly autosomal dominant trait. And first we'll study about men 1, which occurs because of menin gene mutation, and there are total 3 major manifestations, that is 3 P's, and many minor manifestations. The major manifestations, the first one is, and the most common one is parathyroid hyperplasia, that is asymmetrical parathyroid hyperplasia involving all 4 glands. For that we should do sestamibis scan. And the second finding is pancreatic neuroendocrine, most commonly gastrinoma, where there will be excess secretion of gastrin. In response to that, there will be excessive gastric acid secretion. So you can see recurrent peptic ulcers in those patients. So because of recurrent peptic ulcers, there will be diarrhea, malabsorption, steatorrhea, and in the last stage you can also see cachexia in the patient, and it is the most common cause of mortality in men 1. And the last finding is pituitary adenoma. So this will constitute major manifestations in men 1. And the next is, there are many minor manifestations in men 1. The first we'll study about skin manifestations, that is most common skin tumor in men 1 is collagenoma, and the second most common is angiofibroma, and the last one is lipoma. And the most common CNS tumor is meningioma, and the last one, that is most common tumor as a part of minor manifestations, is adrenocortical tumor, and in less than 1% of patients you can also see pheochromocytoma. So these are the minor manifestations of men 1, and these manifestations can be remembered as camel, T for collagenoma, and carcinoids affecting thymus and foregut, that is foregut and thymic carcinoids, and A for adrenocortical tumors and angiofibroma, and ME means meningioma, and the last one L means lipoma. So this will constitute men 1 syndrome. Next we will move on to men 2. Multiple endocrine neoplasia type 2, that is men 2, which occurs because of missense mutation in red proto-oncogene. Men 2 is divided into men 2A and men 2B. Men 2A is again divided into 4 types, that is classical men 2A, and men 2A associated with Hirschsprung's disease, and men 2A associated with cutaneous lichen amyloidosis, and the last one isolated familial medullary carcinoma of thyroid. Classical men 2A has got 3 manifestations, that is medullary carcinoma of thyroid, pheochromocytoma, and primary hyperparathyroidism. So out of these, MTC, that is medullary carcinoma of thyroid, is the most common finding. So these things will constitute the men 2A, and the findings in men 2A can be remembered as a mnemonic HAPPY, H for Hirschsprung's disease, A for amyloidosis, that is cutaneous lichen amyloidosis, P for pheochromocytoma, one more P for primary hyperparathyroidism, Y means thyroid, that is medullary carcinoma of thyroid. This will constitute findings in men 2A. Next we will move on to men 2B. The findings in men 2B can be remembered as 5M plus P. P means pheochromocytoma, which is the second most common finding in men 2B, and most common finding in men 2B is medullary carcinoma of thyroid. And the next remaining 5Ms are rarer findings. Those constitute morphanoid habitus, myelinated corneal nerve fibers, mucosal and intestinal ganglioneuromas, and the last one is megacolon. Megacolon is actually most common in men 2A than in men 2B. And next, men 2B is also known as men 3. And next we'll move on to men 4. Men 4 should be compared with men 1 because there are 2 findings which are common for men 1 and men 4. So men 4 occurs because of CDK1B mutation, and the findings of men 4 are pituitary adenoma, parathyroid adenoma or hyperplasia, and third one is renal or adrenal tumors, and the last one is ovarian or testicular tumors. So these are the findings of men 1 to men 4. So these things are confusing, so I have made you a mnemonic. For men 1, you should remember it with 3 P's plus camel. For men 2A, you should remember it with happy. And for men 2B, that is men 3, you should remember it with 5M plus P's. Thank you.